Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 1. Shock. Drug therapy. Sympathomimetic drugs. Many of the drugs used in the treatment of shock have an effect on the sympathetic nervous system. Drugs that mimic the action of the sympathetic nervous system are termed sympathomimetic. The effects of these drugs are mediated through their binding to alpha or beta-adrenergic receptors. The following are the drugs utilized in the treatment of shock: dobutamine, dopamine, epinephrine, hydrocortisone, norepinephrine, phenylephrine, nitroglycerine, sodium nitroprusside, and vasopressin. Dobutamine. It is used in cardiogenic shock with severe systolic dysfunction, and used in septic shock to increase oxygen delivery and raise central venous oxygen saturation to 70% if hemoglobin is greater than 7 grams per dl or hematocrit greater than or equal to 30%. Nursing implications are as follows. Administration via central line is recommended. Infiltration leads to tissue sloughing. Do not administer in same line with sodium bicarbonate. Monitor heart rate, blood pressure. Hypertension may worsen, requiring addition of a vasopressor, and stop infusion if tachydysrhythmias develop. Dopamine. It is being utilized in cardiogenic shock. Nursing implications are as follows. Administration via central line is recommended. Infiltration leads to tissue sloughing. Do not administer in same line with sodium bicarbonate. Monitor for tachydysrhythmias. Monitor for peripheral vasoconstriction, for instance, paresthesias, and coldness in extremities, at moderate to high doses. Epinephrine. It is used for cardiogenic shock, anaphylactic shock and septic shock requiring additional agent after norepinephrine. Nursing implications are as follows. Monitor for heart rate greater than 110 beats per minute. Monitor for dyspnea and pulmonary edema, and monitor for chest pain, dysrhythmias secondary to increased myocardial volume oxygen. Hydrocortisone. It is used for septic shock requiring vasopressor therapy, despite fluid resuscitation, to maintain adequate blood pressure, and anaphylactic shock, if hypertension persists after initial therapy. Nursing implications are as follows. Monitor for hypokalemia, hyperglycemia, and consider use as continuous infusion. Norepinephrine. It is used for cardiogenic shock after myocardial infarction and septic shock, which is the first drug of choice for blood pressure unresponsive to adequate fluid resuscitation. Nursing implications are as follows. Administration via central line is recommended. Infiltration leads to tissue sloughing. Monitor for dysrhythmias secondary to increased myocardial volume oxygen requirements. Phenylephrine. It is used for patients with neurogenic shock. Nursing implications are as follows. Monitor for reflex bradycardia, headache, restlessness. Monitor for renal failure secondary to decreased renal blood flow, and administration via central line is recommended. Infiltration leads to tissue sloughing. Nitroglycerine. It is used for patients with cardiogenic shock. Nursing implications are as follows. Continuously monitor blood pressure and heart rate, since reflex tachycardia may occur, and a glass bottle recommended for infusion. Sodium nitroprusside. It is used for cardiogenic shock with increased systemic vascular resistance. Nursing implications are as follows. Protect solution from light. Wrap infusion bottle with opaque covering. Administer with D5 water only. Monitor serum cyanide levels, and for signs of cyanide toxicity, for instance, metabolic acidosis, tachycardia, altered level of consciousness, seizures, coma, almond smell on breath. And lastly, vasopressin. It is used for shock states, most commonly septic shock, refractory to other vasopressors. Nursing implications are as follows. Usually administer in low dose. Infusions are not titrated. And monitor hemodynamic pressures and urine output. Kindly click the next button for part 8. Thank you for listening. Have a good day and be safe. Agyamanag.